Now, when you have a patient come in with acne, which I'm sure you have many, how do you determine how to treat that acne?
Well, it's based on I look at the patient first, and then I try to figure out what their environment is, and if they're able to swallow antibiotics, or if they're actually going to wash their face twice a day. Mm-hmm. And then we work together and work with the parents. Then I also teach them how to wash their face, make sure that they're doing a good cleansing with a good product like benzoyl peroxide or salicylic acid. We also use topical treatments. I have to be realistic. If I see a teenager that's not going to be using a product, then I have to choose one thing so they can do it just at nighttime.
But is a topical or an oral medicine more effective than the other?
Depends. Sometimes I'll put them on the oral medicine because I want to get a jump start, and then keep them on topical to maintain it.
Okay. And that's also determined by age, and like you said, you have sort of like an individual. You kind of figure it out what you need. Now, I know there's some medication. I remember growing up, one of the ones they would give you was Accutane. And Accutane is really effective when it comes to treating a severe case of acne. Is that still used, or?
Yes, Accutane is a wonderful medication for patients that really need it and to prevent the scarring. It helps prevent that indented scarring that patients have difficulty treating. Not every patient is a candidate for Accutane because it is 6 months of taking the medication, and there are lots of side effects if we know that the patient is a possible drinks or has some issues at home that would not be conducive for them to take the medication. I have to be able to trust that patient to take the medication. Then I would give them the medication if they're warranted. It works great. After 6 months, the patients never have another pimple usually.
Wow.
And then we can work on the scarring with types of lasers that are non-invasive.